So ankylosing spondylitis is just one diagnosis under this umbrella term called axial spondyloarthritis, which is essentially inflammatory arthritis that primarily affects the spine and the sacroiliac joints.
Axial spondyloarthritis is a progressive type of arthritis. At first, it might just cause low back pain and stiffness. Once you have ankylosing spondylitis, that means doctors can now see evidence of damage to your spine and sacroiliac joints in image tests. Ankylosing spondylitis can keep progressing, leading to more and more damage to these joints.
So it can be important to slow AS progression to prevent the dreaded complication of what we call spinal fusion. And that's what happens when there's bony growths that form in the spine that cause rigidity. And initially what starts off as a straightening of the spine can eventually progress to being hunched over. And this basically decreases mobility and flexibility, and eventually it can even cause difficulty with taking deep breaths. So the mainstays of treatment are aimed at relieving symptoms and also maintaining functional capacity. And we try to do this in a holistic way with both pharmacologic therapies and non-pharmacologic therapies. So non-pharmacologic therapies include patient education, physical therapy that's aimed at increasing mobility, flexibility, and increasing strength and balance. And then some of the pharmacologic therapies include nonsteroidal anti-inflammatory drugs, disease-modifying anti-rheumatic drugs, and biologics, which are aimed at suppressing the immune system that's abnormal and causes the disease. So it is quite possible to live a normal, fulfilling, and productive life with the diagnosis of ankylosing spondylitis. Now, it is a chronic disease, and unfortunately there's no cure, but the goal is to keep you in remission. So I would tell patients with AS to try to be proactive in living the life that they want to live, and keeping communication open with their physician so that if issues arise, that they can be addressed in a timely manner.